Hey everyone, Professor Davis here, and we are going to be looking at the digestive system diseases and disorders. So before we get started, let's talk about the anatomy and the physiology of the digestive system. Now, we are, when we look at structurally, a tube within a tube type of structure, meaning that we have a tube that runs inside of our kind of body, and we call that the alimentary canal. It's a continuous tube that extends from your mouth all the way to your anus. Now, there are parts that specifically will be identified when we look at certain kind of subgroups of the digestive system, and it's known as like the gastrointestinal. These are going to be where it focuses in on the stomach and the intestines. Now guys, your alimentary canal, meaning from your mouth to your anus, is approximately about 30 feet long. Now the function of the digestive system is kind of twofold. For one, it's supposed to help change food into simpler substances. These substances then can be absorbed, like carbohydrates, proteins, fats. They're absorbed by your body in order to be utilized to build our own proteins, to use the sugars for energy and transfer it into ATP. And so we see that that is one of the main functions of the digestive system. The other is to eliminate waste products. There are several things that end up getting added to the feces as it is compacted before it leaves the body. Now, one thing about this digestive system is it is covered with a type of serous membrane in the abdomen called the peritoneum. This membrane is going to help with reducing friction as food moves through the digestive system. We see this movement of food through the digestive system is called peristalsis. Now, peristalsis is the movement of the food. However, the breaking down of the food is going to be through digestion, either mechanical digestion, like with your teeth where you actually chew it into smaller bites, or we see that we have chemical digestion where we use enzymes to break down these substances. Now, there are several structures that are kind of like the primary structures of that alimentary canal, again, extending from the mouth down. So we see that that's where it starts. We have the mouth, which is then connected to the pharynx, which is the throat. The pharynx then connects to the esophagus. This esophagus tube is going to connect the mouth to the stomach. The stomach then is connected to the small intestine, and then the small intestine is connected to the large intestine. The large intestine then exits, or the end of it is known as your anus. However, there are some accessory structures that are also present in this. These accessory structures include your tongue, your teeth, salivary glands, the ones that produce saliva, your gallbladder, your pancreas, and your liver. Now, we're not going to talk about all of the accessory kind of structures in this particular video. We are going to talk about them, especially with the liver, pancreas, and gallbladder, in the next set of videos. All right, so when we get into these diseases or disorders in the digestive system, there are some common signs and symptoms that we may end up seeing. And these are going to be related to kind of three main categories that can occur. The first is there could be some hemorrhaging that takes place. Now, hemorrhaging means that there is a bleed that's present, and some of these bleeds are very mild, but they could also be extremely severe. We can have what we call hematemesis. Hematemesis is where there is blood in the vomit, and so as you are vomiting, the hemorrhaging or the bleeding is part of that. Hemidechesia. Hemidechesia is where we're going to have bright red blood that is in the feces. So that's going to be where it's new, fresh blood that's found in the feces. And then we can have what we call melena. And melena means that there is a dark, tarry stool that is present. This means blood is found in the stool sample, but it is going to be kind of an older indication of blood. So it has this kind of darker color to it. It's more tarry in that stool sample. The next thing we can see is perforation. Perforation means we've actually have a break or a tear that's in this alimentary canal. A problem with this is that if the contents from your stomach or your intestines, small or large, leak into the abdominal cavity, there could be some big problems that occur. Those contents can interact with that peritoneum, that covering, and it can cause peritonitis and inflammation that's present there. We also see that there are a lot of blood vessels through that peritoneum, So if those contents were to also leak and seep into the bloodstream, it could cause septicemia to take place. Another common sign and symptom that we may see with the digestive system is altered motility. Now, the altered motility is the movement of the food through the system, and this could be where it moves the wrong direction, like we see with vomiting. We also see that it can cause issues in leaving through the process of defecation. So when we look at like diarrhea is very loose stool, and this is going to be where water has not been able to be reabsorbed properly due to an irritation in the lining, and we see that the contents move too quickly through those structures, and so it causes that watery stool. This could lead to severe dehydration if not controlled. On the other hand, we could have constipation, which is a problem with going to the bathroom. The feces stays too long inside the body. It starts to compact. It gets very hard. Too much water gets removed, and so it's difficult to get that feces out. A lot of times when we talk about constipation, it is due a lot of times to poor diet as well as poor elimination habits, like holding it for too long, not going to the bathroom when you really need to. All right, so when we talk about these different diseases and disorders of the digestive system, there are some diagnostic tools and there are some diagnostic tools that are used on a regular basis that we'll see through some of these. And so the first one we want to look at here is an x-ray. Now, x-rays normally show hard parts within the body, and so we would not be able to use an x-ray just by itself unless we're looking for like stones in something like the gallbladder or something like that. However, we can use an x-ray with what we call the GI series. You can do an upper GI series where you do a barium swallow. You end up having to swallow that barium, and it coats the different structures of like your esophagus and your stomach, and it allows them to take an x-ray or series of x-rays to see the structures and how those structures are functioning. On the other hand, we can also do a lower GI series. This is going to be where they use the barium as well, but they're going to give it to you through an enema, inserting it through your anus and colon. And so then because of this, they can look at those lower structures, again with a set of x-rays. Now, when we do barium swallows, one thing that's really important is that the patient does not have anything to eat prior to this, at least for 8 hours. So a lot of times this is going to be where the patient may have something on there that says an NPO, and this means nothing by mouth for a certain amount of time. With the lower GI series, we want to make sure that majority of the feces has been removed before we do this. And so a laxative may need to be given in order to remove the feces, clean them out. And they would also need to be on a clear liquid diet prior to this procedure. We also see that we could do a series of what we call endoscope exams. These endoscope exams are where they take a type of camera with a light and they push it through those tubes. You can see that here in this picture. All right, this one they're going through the mouth, so this would be kind of looking at the upper GI tract here. And depending on what structure they're focusing in on, a lot of times the endoscope exam gets a name. So we have things like a gastroscopy is going to be looking at the stomach. We have a colonoscopy is going to be looking at the colon. We have the sigmoid oscopy. That one's going to look at the sigmoid. So we can be very specific. This one, this really large one that you see here that we call an EGD, whether it's the esophageal gastroduodenal endoscopy, that one is going to be a total upper GI. We're looking at the esophagus, the stomach, and the beginning part of the small intestines known as the duodenum. And so because of that, it's looking at that entire upper GI system. Another type of endoscopy that we can end up doing, or an endoscope exam, is they can do what we call a video capsular endoscopy, where the individual is going to end up swallowing the camera, and it's going to then collect information and send photos periodically in order to be able to look at the internal structures a little more closely. Now, there are some limitations with this one. We cannot give this one to a patient who actually has like an impactation or a blockage that's present, because this would just add to the problem. Another thing we can look at Occult blood, this is going to be where we look for blood within a stool sample, whether it's fresh blood or it's more of a older, drier type of blood. It does give us an indication of what might be going on. And so a stool sample could be useful here. Another is where we could do an ova and parasite test, also known as an ONP. This is going to be where we're looking specifically for eggs of parasites or the parasites themselves. This can be very helpful with a lot of different worm infections, specifically when we look at tapeworms, roundworms, pinworms, and even hookworms. There are some protozoas as well that we could detect with this test. All right, so first thing we want to look at, we're going to start at the top, is the diseases of the mouth. And so one of these that's pretty common is known as dental caries. Dental caries are also known as cavities. These are seen more often in children and young adults, and a lot of times this has to do with their brushing habits as well as their consumption of large amounts of sugar. However, when we look at dental caries, this is disease of the teeth. It is due to the bacteria that lives in your mouth. So every person has kind of a different chemistry of bacteria that's present, but everybody has it. And this bacteria is on your tooth surface. As we feed that bacteria, it starts to develop a type of plaque that's present. It's kind of a slimy type of substance that starts to collect on the teeth. However, it can also start to harden and get underneath the gums, which we'll talk about more in a minute. Now, when we look at this, guys, this kind of buildup of plaque and potentially the beginning of what we would call these cavities are going to cause infection potentially in your mouth, as well as pain, and tooth loss might occur, okay, where it starts to erode and decay so much due to the bacteria that we may end up having to lose those teeth. There's a lot of different dental techniques that are used. It might be where they are going to drill and remove as much of the cavity as possible, and then you get fillings. They may put caps. They may have to pull the tooth all together. So there's different things. And there are some preventative measures when we talk about cavities, dental caries. We do see that, of course, your brushing habits and flossing are important. Removing that extra plaque is also really important, and that's can be done by going to the dentist on your regular checkups. Now, in adults, we see that we can develop what we call periodontal disease. Now, periodontal disease affects supporting structures of the teeth and gums, and so we do see that this is a little bit more advanced than what we just saw with the dental caries. It is going to be the main cause of tooth loss in adults. Now, the causes of this, of course, are going to be poor oral hygiene, not taking care of your teeth like you should, inadequate diet. This could lead to things like gingivitis, where the gums themselves start to get very inflamed. We do see as well that one of the main ways to diagnose periodontal disease is, of course, going to the dentist. And with the dentist, they're going to look for redness and puffiness and bleeding with your gums. You can see that there's some puffiness that's around that can happen on the gums. And that a lot of times is due to plaque getting pushed under the surface of those gums. Another thing is they're going to check the actual tooth pocket under the gums and how deep that goes. And if it's 3 millimeters or more, you have pretty extensive periodontal disease, which means that those teeth are going to be potentially in danger of being lost. So how do we prevent this? Well, of course, brushing and flossing, having good brushing and flossing habits, regular dental care, and then also adequate diet. One of the main things is cutting out a lot of that excessive sugar and processed sugar that the bacteria would prefer to feed on. Continuing on with the mouth, let's look at some potential mouth cancer. Mouth cancer can occur on the lips, cheeks, gums, the palate, so like the top part of the mouth, as well as the tongue. We do see that one of the most common oral cancers that there are is called squamous cell carcinoma, and it's mostly located on the lip, like you see in this picture. Usually it's going to be found on the lower lip, and it's from exposure to sunlight. You have a higher risk if you chew tobacco or if you're a pipe or cigar smoker. Now, we find this type of cancer to be more prevalent in males, and it can cause what we call these like small pale colored painless lumps to start to develop on the lip itself, again based on this picture. And the main way to diagnose this is to do a tissue biopsy and look for those cancer cells. Treatment would be radiation, also surgical excision of the cancer. And we want to make sure that we get all of it Okay, and otherwise we may have to continue the radiation and potentially chemotherapy if this starts to metastasize, but normally it doesn't. Prevention. There are some things that can help prevent this. Decreased exposure to sunlight, because that's one of the precursors of this. We also see using sunscreen and wearing hats and things like that to help protect your face from the sun. And then also eliminating the use of tobacco products can also reduce your risk. Moving on down from the mouth, let's look at the throat, the pharynx. Now, when we look at the pharynx, guys, sometimes some of these diseases, especially this one we're going to talk about here that we call a sore throat, could also be categorized as a respiratory infection or a respiratory problem, because the pharynx is that connection where we have the respiratory system will then go down from there to the trachea, but the digestive system will leave through the pharynx through the esophagus. And so sometimes it gets categorized as a respiratory problem. But we do see that this is known as pharyngitis. Pharyngitis is a sore throat. It could be a viral or bacterial cause when we talk about this, but one of the most common types is what we would consider strep throat. Strep throat's one of the most common types of pharyngitis that are present. Now, when we want to diagnose pharyngitis, one of the things we'll look for is redness back in the throat. We'll also see if they have their tonsils. We'll look to see if the tonsils are inflamed, and that's what we would consider tonsillitis to occur. And also those tonsils could be trapping the bacteria or the virus, and the body could be fighting it, and pus could be created. So you may see these pus pockets back there in the throat like you see in this picture. The main way to diagnose this, to know what we're dealing with that's causing the sore throat, is through a throat culture. We can culture out that area of the throat, grow it on a plate, and see what kind of bacteria we are dealing with. This could also help us with the whole idea of what antibiotic we should give. If it's bacterial based, antibiotics can be given, and we can even be very specific on those types of antibiotics when we're looking at the fact that we can figure out which bacteria it is. If it is a viral infection, however, antibiotics should not be used for treatment. The main thing is just to support the patient so that you're dealing more with just the symptoms, so their body can fight off the infection like it needs to. Some big preventative things when we're talking about like pharyngitis and strep throat would be hand washing. Okay, so making sure that we wash our hands well. And if you have had a sore throat due to an infection, you should change your toothbrush after that. Don't utilize the same toothbrush, because you could end up doing reinfection of your throat. All right, so let's move down to the esophagus, and we are looking at the connection in this case between the esophagus and the stomach. This is known as reflux esophagitis. It's also known as gastroesophageal reflux disease, or GERD. Okay, so this is what we're looking at when we talk about what we would say reflux, or what a lot of people will say that they have heartburn. It's inflammation of the tissue at the lower end of the esophagus as it comes into the stomach. It's caused by a backflow of the stomach acid into the esophagus, because that cardiac sphincter, the little sphincter that's supposed to close off on that end of the esophagus, doesn't close right, and so the stomach acid splashes into the esophagus. This causes it to burn a little bit because that tissue is not protected against that stomach acid like your stomach tissue is. Okay, so it causes an issue there. Some symptoms include what we call the heartburn. It's the burning in the chest area. Okay, we would say it's burning up here in the chest, mid-chest area, or the epigastric area, just right underneath the diaphragm. We do see that if this reflux becomes more long-term, it could cause bleeding in the esophagus, ulceration, and even scarring to take place. So we want to take care of this relatively quickly. We do see that the main way that we would diagnose this is through a barium swallow x-ray, and then also a biopsy of that tissue. Part of the reason we would want to do a biopsy in the esophagus at this area is to make sure there's not any cancerous cells that are developing due to the damage of the acid. So what kind of treatment do we have for reflux or GERD? Well, the big thing when we look at treatments is we want to try to reduce the amount of reflux. We want to reduce the amount of acid that's coming into the esophagus. So some ways to do this are for the patient to avoid eating very large meals. If we eat large meals, it fills up the stomach more, causing you to have worse reflux. We also see that they may need to avoid spicy meals, caffeine, and also tight clothing. That doesn't allow for expansion of the stomach. The spicy food and the caffeine could actually irritate the lining, cause increased amounts of acid being formed in the stomach, which would aggravate this problem. We also see that they may want to take stool softeners. Using laxatives to help move the food and everything through the system a little more quickly may be helpful. Taking antacids or anti-reflux medications may be useful, like Tums or maybe Prilosec, whatever it may be that you would use for that. One thing that causes a big issue with reflux is if you lay flat. Okay, so laying flat in the bed could cause it to be worse, and so laying at an angle might be helpful, like sleeping in an armchair or things like that. You could actually elevate the head of your bed, and this would help with that. Okay, so gravity would actually be helping you keep things pushed down. Some things that could help reduce your risk of developing this would be avoiding smoking, limiting your carbonated beverages, decreasing the amount of chocolate, getting rid of some of those high fat foods that you may have in your diet, and don't eat late night snacks. Another thing that could be helpful is weight loss or controlling your weight. A lot of times when people have extra weight that they're carrying, their reflux tends to be worse just due to the pressure from that extra weight. All right, the next one we want to look at is called the hiatal hernia. Anytime we talk about a hernia, this means that a piece of something is going into a location that it really shouldn't. And so here is where part of the stomach is sliding into the chest cavity. Your stomach is supposed to be in your abdominal cavity. Remember, the diaphragm separates your abdominal cavity from your chest cavity, and the stomach is right underneath that. The problem, though, is there is a hole that is present, and this is a natural hole where the esophagus can travel through. What happens here with the hiatal hernia is the stomach starts to protrude and push through that natural opening, going into the chest cavity where it's not supposed to. Now, the chances of this happening increases with age, and this could be due to the weakness that happens with that cardiac sphincter, that is that connection between the esophagus and the stomach. Sometimes with this, hiatal hernias are asymptomatic, but they could have symptoms that are similar to reflux due to the pressure that's being built up by the stomach moving where it should not go. The main treatments that we would see for hiatal hernia are going to be similar to reflux. We may also need to go in and reinforce that hole that the esophagus travels through to prevent the stomach from moving up into the chest. Another thing that we can end up seeing on the esophagus is what we call esophageal varices. These are enlarged tortuous veins of the esophagus. And so these are known as varicose veins of the esophagus. Most of the time when we think of varicose veins, we think about them like especially in our legs, where it's this bulging of the vein that's present. This can also happen pretty much anywhere in your body, but in this case, it's on the esophagus. This usually develops in relation to a blockage of blood flow to the liver. Okay, and so really the liver is the problem, but this is a side effect of that. And so since there's a blockage of blood flow to the liver, we see this area starts to get inflamed. The most common cause of that blockage in the liver is known as cirrhosis. The most common cause of cirrhosis, which we'll talk a little bit about in the next chapter, is excessive alcohol consumption. Now, symptoms when we talk about these varicose veins that are present is vomiting can occur from the patient, blood in the vomit, as well as the stools becoming really black due to the amount of blood that's been added in to the digestion. We also see that diagnosis is going to be done most of the time by detecting decreased blood pressure and also finding blood within the stools. Treatment. Treating or preventing the causative factor can help prevent this particular disease. So taking care of the liver and making sure that blood flow to the liver is good, that will help prevent these from being developing. So the big thing here is to stop drinking. So if they drink alcohol and it's causing cirrhosis, we would want them to stop drinking alcohol so that we can start to get that cirrhosis maybe a little more under control. Not that we're going to necessarily reverse it or anything like that, but just get it under control so this complication does not occur. Now guys, if these blood vessels that are bulging do end up rupturing, hemorrhaging, that can be life-threatening for the patient. The patient could bleed out very quickly. All right, the last thing we're going to talk about in this part 1 here is diseases of the stomach. So we're going to hit on a few things with diseases of the stomach. So we see here with gastritis. Gastritis is inflammation of the stomach itself. When we look at gastritis, some symptoms here would be abdominal pain. You might have some nausea. There might be belching that occurs, and it could cause or induce vomiting. Now, anything that irritates the stomach could cause gastritis. All right, so any kind of irritating agent. It could be food you ate. It could be something on how it was prepared. It could be bacteria. It could be virus. Something could cause an issue here. But and some of these examples include things like aspirin, alcohol, coffee, tobacco. Bacteria-laden foods can cause issues with this. And one of the main bacteria that is the culprit for gastritis is due to a bacteria that you see here in this picture called Helicobacter. Helicobacter gastritis is caused by this small bacteria as it attacks the stomach lining. Now, treatment, when we look at this, or actually let's talk about diagnosis first. Diagnosis of the Helicobacter gastritis is done through a biopsy. We take a kind of piece of that lining of the stomach and we look for this bacteria. Now, treatment. Medications to reduce stomach acid may need to help in the treatment of some of these irritations that take place. If it is due to the Helicobacter bacteria, the H. pylori bacteria, we want to give antibiotics to help treat this. Okay, so we want to be able to treat that bacteria and get it under more control. Now, we can see that there could be a development, especially if gastritis continues, into what we call peptic ulcers. These are found in the stomach. If they're found in the stomach, they're also kind of termed as gastric ulcers. If they're found in the duodenum, that first part of the small intestines, they're called duodenal ulcers. Usually these guys are caused by uncontrolled H. pylori bacteria. Other causative factors that could cause peptic ulcers to develop and worsen are things like stress, not controlling that stress, smoking, drugs such as aspirin, steroids, and alcohol. Now, when we look at the symptoms of peptic ulcers, we do see that there's a lot of times pain that's present because what's happened here is that there has been an eroding of the stomach lining. That protective mucus layer that normally would protect the underlying stomach tissue from the acid is no longer present. So the stomach acid starts to eat away and wear at the tissue. This could potentially cause this ulcer area to start to bleed. If it gets thin enough, we do see that proliferation could occur where there's actually a breakage in the stomach lining. And we do see there could also be an obstruction that could develop due to these ulcers. So what kind of treatment do we have for peptic ulcers? Well, one, we want to reduce the contributing factors. What's causing the ulcer to develop? Is it stress? Well, we need to do more stress management. Is it smoking? Well, we need to stop smoking. And so we would want to look into those things that might be causing those peptic ulcers to develop. Another thing is taking some antacids to calm the stomach acid down so that they don't go into complications of bleeding ulcers. And then surgery in very severe cases may need to take place. The last thing we want to look at in this particular lecture is the stomach cancer. Stomach cancer often goes undiagnosed until it actually metastasizes and spreads to other places. Some of the common places that it will spread to are nearby, and these are things like the pancreas, the intestines, and the esophagus. Now, there are some causative factors that could cause the development of stomach cancer, or at least be linked to it. Some of them are food additives, especially foods that are smoked, salted, or pickled. If you eat those in very large amounts, you're increasing your risks of potentially stomach cancer. We see that the male gender also increases your risk. We see that stomach cancer affects males more than females. And also cigarette smoking. So these are all contributing factors. Now, what are the symptoms of stomach cancer? Well, individuals have loss of appetite, general stomach distress when they do eat something, and they may end up having some extreme heartburn. The main way to actually diagnose stomach cancer is through a biopsy. A biopsy would confirm that cancer is present. If that's the case, treatment options would be surgical resection, taking out the part that has the cancerous tumor and the cancer cells present. Chemotherapy and radiation would also need to be done. Now, prognosis for stomach cancer is actually very good if it's discovered early. The problem is often it does go undiagnosed until it metastasizes. Because once cancer spreads and metastasizes, it makes it a whole lot harder to treat, no matter what the cancer is. All right, so this finishes up part 1 of the digestive system notes. And so if you have any questions or concerns, please let me know.